Disaster management is the complex process of preparing for, responding to, and recovering from disasters. Disasters are events that cause widespread damage, loss of life, and disruption to society. They can be natural, such as earthquakes and hurricanes, or human-made, like industrial accidents and conflicts. Effective disaster management requires a coordinated effort from various actors, including governments, non-governmental organizations, and international organizations. These actors work together to reduce the risks of disasters, mitigate their impacts, and help communities rebuild. International organizations play a crucial role in this process by providing technical expertise, financial resources, and logistical support. They also facilitate cooperation and coordination among different countries and actors. The work of international organizations is essential in saving lives, alleviating suffering, and building resilience in the face of disasters. Collaboration is essential in disaster management due to the global nature of many disasters and the need for specialized resources. International organizations provide a platform for information sharing, resource mobilization, and coordinated action. Collaboration enables a swift and efficient response to disasters by avoiding duplication of efforts and ensuring that aid reaches those most in need. It also facilitates the development of comprehensive strategies for disaster risk reduction and long-term recovery. International organizations, through their collaborative efforts, play a crucial role in building global solidarity and fostering a sense of shared responsibility in the face of disasters. The United Nations plays a central role in international disaster management. Its mandate encompasses peace and security, human rights and development, all of which are interconnected with disaster risk reduction and response. The UN Office for the Coordination of Humanitarian Affairs is responsible for leading and coordinating the international humanitarian response to disasters. The UN Development Programme focuses on disaster risk reduction and recovery, helping countries to build resilience and reduce the impacts of future disasters. Other UN agencies, such as the World Food Programme and the UN Refugee Agency, provide specialized assistance during disasters such as food aid and shelter. The World Health Organization is the leading international organization for global health. It plays a crucial role in preventing, detecting, and responding to health emergencies, including those caused by disasters. WHO provides technical guidance and support to countries to strengthen their health systems and prepare for emergencies. It also coordinates the international response to outbreaks of infectious diseases such as Ebola and COVID-19, which can be exacerbated by disasters. WHO works to ensure that affected populations have access to essential healthcare services, including vaccinations, safe water, and sanitation during and after disasters. Section 5. The Red Cross, a beacon of hope. The International Red Cross and Red Crescent movement is a global humanitarian network that provides neutral and impartial assistance to people affected by disasters and armed conflicts. The International Committee of the Red Cross, or ICRC, focuses on protecting victims of war and internal violence, while National Red Cross and Red Crescent societies provide disaster relief, healthcare, and other humanitarian services in their respective countries. The Red Cross and Red Crescent are known for their principles of humanity, impartiality, neutrality, independence, voluntary service, unity, and universality, which guide their actions in disaster response. Their extensive network of volunteers and staff enables them to respond rapidly and effectively to disasters around the world. Section 6. Coordination and collaboration key to success. Effective disaster management relies heavily on seamless coordination and collaboration among international organizations. This involves sharing information, coordinating logistics, and pooling resources to maximize the impact of their efforts. The UN plays a central role in facilitating this coordination through OCHA, which convenes humanitarian actors to develop and implement coordinated response plans. International organizations also work closely with national governments, local authorities, and civil society organizations to ensure that their efforts are aligned with national priorities and local needs. This collaborative approach is essential for avoiding duplication of efforts and ensuring that aid reaches those most in need. Section 7. Case study, the Haiti Earthquake. The 2010 Haiti earthquake, which devastated the capital city of Port-au-Prince, demonstrated the crucial role of international organizations in disaster response. The UN, WHO, Red Cross, and numerous other international NGOs mobilized rapidly to provide humanitarian assistance to the affected population. This included search and rescue operations, medical care, food and water distribution, and shelter. The UN also played a key role in coordinating the international response and providing logistical support to humanitarian organizations operating in the country. Despite the challenges, the response to the Haiti earthquake showcased the importance of international cooperation and the ability of international organizations to provide vital assistance in times of crisis. Section 8. Case Study: The COVID-19 Pandemic. The COVID-19 pandemic highlighted the importance of global health governance and the role of international organizations in responding to public health emergencies. The WHO played a leading role in coordinating the international response to the pandemic, providing technical guidance to countries, tracking the spread of the virus, and supporting the development of vaccines and treatments. Other UN agencies, such as UNICEF and the World Bank, provided support to countries to mitigate the social and economic impacts of the pandemic. The pandemic also underscored the importance of international cooperation and solidarity in addressing global challenges. Section 9. The future of disaster management. As the frequency and intensity of disasters are expected to increase due to climate change and other factors, the role of international organizations in disaster management will become even more critical in the future. International organizations will need to adapt to these evolving challenges by strengthening their capacities for disaster risk reduction, preparedness, and response. This includes investing in early warning systems, building resilient infrastructure, and promoting sustainable development practices. Continued collaboration and innovation will be essential to effectively address the complex challenges posed by disasters and build a more resilient and sustainable future.